Horizon, and universities and TVET colleges are gearing up, but we are obviously in the middle of a pandemic. So how will the exams be invigilated? I'm joined by Dr. Ramneek Ahluwalia, the CEO of Higher Health. A very good morning to you. How do we crack this in this time? How do we invigilate these exams?
Good morning to everyone and to yourself. Thank you. You're absolutely right. In the COVID situation where we actually know that the summers won't make any difference compared to what the COVID can do for us. COVID remains around us. It keeps growing. And this pandemic is about to stay till we develop something to overcome this pandemic. And we are now coming to a phase where in lockdown 1, we have allowed 100% of our students to come back. The whole institution is working the way it should be working as contact learning. And then now it's our period where from October till December, which is from now on, we are going to be starting exams. And we just want to ensure that exams are absolutely done in the most preventive way where we do not limit the spread of the infection. So right from looking into engineering controls, which is building structures, which building rooms to be used, looking into considering that we know this disease is airborne and has got air droplet spread. In that situation, we need to have rooms with high ventilation source. So our engineering structures needs to be relooked. Windows, they are jammed or not jammed, multiple outlets or entry points into the room so that we do not have congestion at the gates. How do we ensure that there's a whole world that has to work towards preparing the exam room. And then it's a work about preparing the examiners who have to examine the exam on that day, or the invigilators. And the most important thing is how do we sanitize the surfaces, how do we sanitize or clean or disinfect the exam papers. So how much isolation period, knowing the virus and the science of the virus, we know the science of the virus, it survives on soft tissues from 6 hours to 12 hours. Keeping that in mind, it lives on a human skin for 9 hours. It lives on a cardboard for 12 hours and a paper on 12 hours. So keeping that isolation point, and from there, ensuring that the exam papers again go back to isolation before it goes for invigilators for exam. So right from engineering, administrative management, obviously the PPE, the wearing of masks, the 360 degree of 2 meters physical distance around each student. So every parameter needs to be now looked into before we conduct exams. And that's why this protocol became very important in this period.
Ramneek, I mean, that sounds like the perfect protocol if you can pull it off. But not all institutions are in a position to be able to implement that, are they? I mean, how do you oversee 100% success here?
So you're absolutely right. Higher education is not just UCT and University of Pretoria or Stellenbosch, which have sound capabilities from the historic infrastructures that they have built. But I'm talking about our campuses in Bizana, in Ladysmith, in our Walter Sisulu campus in Butterworth. And that's probably 92% of our entire infrastructure. So we've got about 1,800 community education training colleges. We've got about 300 TVET colleges. And probably most of our universities are now semi-urban and rural. So you're absolutely right. So we have to look into every parameter in a more holistic way. So what we've done is, since the COVID started, since March, we've developed about 13,000 frontline workers. These are security, these are students, wardens, resident officers, student affairs, our clinic nurses, our frontline staff. And we did it on the site trainings. We build them structure by structure at every campus level. Then we also have a fleet of about 4,000 now student volunteers that work day and night towards COVID-19, putting screening processes in place. We've gone into digital screening tools with the health check, which is more it's toll free, it's available on USSD, WhatsApp. All these things were done prior to our reopening in our phased approach of lockdown 4, 3, 2, and 1, predominantly so that when the students come, because we are in higher education, there are about thousands of students coming in one time in the campuses. And so you can't have a congestion at the gates, because if even in a small thing, when they're coming inside, you can actually blow the infection away to another extent. So building green passports, trying to enter in a systematic way, having screening stations run by administration at every gate level.
And I guess you're going to have to facilitate a lot of extra time in there. Ramneek Ahluwalia, good to talk to you. Thank you very much for that.
All right, well, let's come to this now. Your newspaper